Okay, so now that we've kind of figured out what's going on, we're gonna create an exercise routine just to kind of really help with the posture and the biomechanics of your upper body to help hopefully reduce that shoulder pain. I just wanted to start by showing you exactly what I think is the issue with you. If I look at this, can you see it?
Yeah.
Okay, so this is what upper cross syndrome is. Basically, in a visual so you can see it off of your body. It's kind of that posture you get from when a lot of office workers and people who work at computers tend to have. And basically what it is your front shoulders are very tight, your back between your scapulas or your shoulder blades are very weak. Your neck muscles here tend to be weak from looking down, and you tend to be a little tight in your neck muscles in the back from being in that posture position. So the aim of the program that I put together is to really correct this. And because you're someone who doesn't do a lot of sports or a lot of heavy intensity exercises, we're going to start at the base to really rebuild those mechanics and then hopefully build up from there. Before we get into the program, though, there is just two more tests I want to do that I forgot to do last time just to clarify some muscle strength. So what I'm gonna have you first do is just stand up, and I want you to go so your back is against a wall.
Uh,
Perfect. Now I'm gonna turn my laptop so you can see what I'm doing. So what I'm gonna have you do is kind of be a little bit off the wall, about an inch to an inch and a half, so your back is off of it. You're gonna put your arms against the wall like this. I'm gonna get you to move over so your full arms on it. Perfect. And I'm gonna get you to have your thumbs pointing towards your, like, away from your body. So like you're doing a thumbs up that are kind of going like, yeah, exactly. And I want you to bend your knees slightly and just push using your arms into the wall. Using this part of your arms. How does that feel?
okay.
So, is it hard? Is it easy?
It's hard, but it's not painful.
Okay, that's okay. Now what I'm gonna have you do is you don't have to, you're gonna turn your thumbs the other way. So your thumbs are towards the wall, but you can tuck them in just so they're not hitting the wall. So you're doing like a fist with your thumbs towards the wall. And now you're gonna do the same thing. You're gonna push into the wall. How does that feel?
Okay.
Is it harder or easier than the other ones?
Be a little harder, but not terribly.
Okay, so those two things I was testing were your lower traps and your rhomboids, which are the muscles that are kind of in between your scapula. I had to adapt the test a little bit just given the circumstances that I can't be on you doing the manual muscle testing myself, but it does give me an idea that if it was hard, that it is something we can improve on, and it makes sense with the whole symptoms of the upper cross. So the first thing I'm going to get you to do is grab a tennis ball or a golf ball. Perfect. And I'm going to go grab my ball just for demonstration. Okay. So what you're going to do is we're going to try to release the tightness of the muscle here first and the tightness of your scalenes here. And then we're going to try to stabilize to help fix the posture. So you're going to take your ball and you're going to go right in the front of where your armpit is. And you're going to try to find some trigger points. So any points that when you push on it are a little tender or sore, and you can go all the way close to your pecs that go from your sternum to your shoulder and see if there's any tight little spots that you feel. And if you feel some spots, you can kind of just stay on that spot and kind of roll the ball in small circles, both clockwise and counterclockwise. And what this is going to do is it's going to help relax the muscle. Perfect. Are you feeling any trigger points?
A little bit here.
Okay, so we're gonna sit in that spot and just kind of really work on it. And when you do this at home, I'm gonna get you to do it kind of for um about 1 to 2 minutes, and you can do it up to 3 times a day. So you're just kind of like working out some of the tightness in the muscle. Sound good?
Yep.
Okay, the second exercise I'm going to have you do is kind of a variation on one of the tests I did. Remember that test where I got you to put your hand on your clavicle, pull it down, and then kind of look away to stretch the muscle here? Yeah, we're going to start in that position. So you're really going to push down on your clavicle to try to elongate the muscle there. And then what I'm going to have you do is from this position, you're actually going to turn your chin, sorry, towards your other shoulder. Not that much. Okay, so we're gonna start here. Look at me. We're gonna start with our head in neutral, tug our clavicle down, and then look up like that. Don't turn your head quite as much. It's a very subtle movement. I really want you to focus on driving your chin straight up to elongate here. Do you feel the stretch in your neck?
Yeah.
Okay, so now what I'm gonna have you do is you're gonna take your other hand and just put it on your chin. You can drop the tennis ball. It may be easier if you just put, yeah. Then what I'm going to have you do is try to push into your chin and bring it back to that neutral position while resisting it. So it's going to look like this. If you want to stop for 2 seconds. So we start here, hand on the clavicle and up, fingers on chin, and we're going to push into our fingers, trying to bring our head back here. We're going to hold that contraction for 5 seconds, and then we're going to relax for 2, and then try to go more into the stretch. So if you want to take a second and just look at me, I'll show you what it'll look like all together. So we start here, hold down, look up, stretching the muscles here. I'm going to push into my fingers, 2, 3, 4, 5, relax, and then trying to go more into the stretch and pull my clavicle even lower, trying to elongate the muscle here. Go ahead and try. 2, 3, 4, 5. Good. Relax for 2 seconds. And now try to pull your clavicle down a little bit lower, trying to get a little bit further into the stretch. Good. And we're going to hold that for a little bit. Good. And now you're going to push into your fingers again for another 5 seconds. 2, 3, 4, 5, 6. Good. You're going to relax and try to go a little bit further into the stretch again. Good. And we're going to do it one more time. So push into your fingers for 5 seconds. 2, 3, 4, 5, 6. Relax for 2 seconds. And try to go even further into the stretch. Go ahead. And we're just going to hold that for a couple of seconds. Good. And relax. How did that feel?
Good, but now it pulls on this side, so I'm just gonna have to be careful that I don't.
Yeah, again, I'm showing you all on your right side because that's where the problem is, but these are exercises you can do bilaterally, and then that way it kind of balances it out.
Yeah.
So those are going to be the two you do to kind of release the tension in the front and the tight muscles. And then after that, we're going to go into really stabilizing the weaker muscles in your back. Now that we have the range of motion to kind of do that. So what I'm going to get you to do is you're going to stand up. And we're going to do something called YTWs. So how it's going to be, I'll let you look at me first, is you're going to stand hunched over at your hips with your body at like a 45-degree angle. Then what I'm going to have you do is try to keep a nice straight spine in your lower. And you're going to start with your arms out by your side. And you're going to come in really trying to squeeze your scapulas together. So your shoulder blades coming in together. And we're going to do it in a T position, a W position, so a little bit less out to the side and a little bit more like this, and then a Y position, so a little bit more straight in front of you. The important thing is, wait 2 seconds, the important thing is when you do this exercise, I really want you to envision taking the bottoms of your shoulder blades and moving them towards your opposite pocket. So you're really trying to squeeze in and down. So we'll start at 45 degrees. So put your arms out for 2 seconds. We're gonna get into a nice neutral position first. Do you mind lowering your screen just a little bit so I can see your body alignment?
Lower it.
Yeah, lowering it just a little bit. Perfect. So I'll get you to stand in that 45-degree angle. Nice knee, bent knees, shoulder width apart. You're gonna make sure you have a nice straight back. I don't want to see any arching, okay? I want it to be a nice neutral position. Good. You're gonna look slightly forward, so I don't want your head chin tucked and I don't want it extended. Just nice and neutral and straight. Okay, tuck your chin in just a little bit. Good. Okay, and now you're gonna put your arms out straight out to the side like you're making a T with your body. And I really want you to focus on bringing them in by bending your elbows. So bringing them in like this and squeezing your scapulas together. I want your elbows to stay in line with your body as much as possible. So, can you bend forward a little bit more? Good, and I want you to not arch your back quite as much. Look at me for 2 seconds, relax for 2 seconds. Right now, what I'm seeing is to get the motion, you're going like this and arching your lower back. I want you to keep this nice and straight. I want the movement to come just from your shoulder blades. Good. How does that feel?
Good.
Good. Is it too hard?
It's no, it's okay. I just need to
You got the
practice.
coordination? Okay, so the movement I want you to do with your shoulder blades, we're gonna just go over some scapular movement for first, and then we'll get into it, okay? So I'm gonna get you. I'm gonna put it on my t-shirt just so you can see the movement, just so I'm not wearing a bulky sweater. But what I want the movement to be is you're going from your scapulas being normal like this to bringing them in like this. Do you see that movement? So my shoulders are like this right now, and I want to bring them in. Do you see?
Yeah, but are you pushing your whole shoulder back?
No, I'm pushing what I'm envisioning is drawing a line from the bottom of my scapula right here down to this pocket. So it's back and in. Your chest will come out a little bit, but it's really the shoulder blade that's moving and setting. Okay, I think our first exercise before we get into those, which is okay, when your body's not used to being in that position, it's hard for your scapulas to get the movement. So we're gonna start with just practicing the scapular movement. So I'm gonna get you to sit down. So instead of doing the other exercises, we'll do this one, okay? The other exercise, so instead of doing this one, we'll do the one I'm about to show you instead, okay? So you're gonna just sit up straight. And what I'm gonna get you to do is to squeeze and try to pinch your shoulder blades together and down and hold that for 6 seconds. 2, 3, 4, 5, 6. Good. And now you're going to relax. And we're going to do that again. 2, 3, 4, 5, 6. And relax. And again. 2, 3, 4, 5, 6. Okay. During your exercise program, you're going to do this 2 times 12 sets of that squeezing, okay? And the goal in this is it's going to be the first step in getting to strengthening the muscles here. To be able to strengthen the muscles, we have to first be able to contract the muscles and let our brain tell our muscles what to do. So we're really working on that muscle-brain connection right now. And that is going to be the first step that we can eventually progress off of. Sound good? Okay.
Yeah.
And the important thing about this is that any exercises that we do for your shoulder or your upper body, the movement comes from your scapula. It's kind of like the foundation of all the movements. So we want to make sure we can build on that foundation to then build further up and increase some of the strength and mobility in the shoulder itself. That being said, we can still work on some of that while we develop this. So the next 2 exercises we're going to do is going to be really more for one is for more scapular stability and the other one is for more shoulder mobility. So the next one I'm going to have you do is you're going to stand in front of a wall. And I'm gonna have you put your forearms on the wall. It's okay if your elbows aren't touching, but I want your elbows and forearms to be straight. And I want you to again have that nice neutral back. So I don't want to see arching. I want to see a nice neutral spine. And all you're gonna do is that same, I want you to start by squeezing your scapulas together. Good. And then you're gonna slowly slide your arms up until you feel like you can't squeeze your scapulas together anymore. Good, you'll stop there, and then you're gonna come back down. Good. And then you're gonna slide up again for 3 seconds, 2, 3, and back down for 3 seconds, 2, 3. Okay, you're gonna keep going, and now go back up, nice and slow. I want you to watch your back. I don't want you to arch your lower back, okay? I don't want you to get the movement from your lower back. I want you to get it from just your arms, okay? Good. We're gonna do it one more time. Watch the back, watch the back. Good. And then back down. How does that feel?
Good.
Good? Does it feel challenging?
A little bit.
A little bit? Okay, good. That is working a muscle called your serratus anterior. And what that muscle does is it helps keep your scapulas on your rib cage. So again, helping with the support of stabilizing. The last exercise I'm going to give you, because I know you're very busy with work and work a lot of hours, so I don't want to give you anything too long or too strenuous, because then you're not going to do it because you won't have the time to do it, which is understandable. So we're going to keep it short and sweet. The last one I'm going to get you to do is you're going to hold some sort of heavy-ish object, maybe like a max 4 pounds. So for me, for example, it can be a can of soup, it can be a water bottle, it can even be just like a container with pens in it or something.
Are these too heavy?
That might be too heavy. Do you have like a stapler or something like that?
Yeah, it's not heavy though, it's light.
Okay, so we'll use that just for demonstration purposes, but then when you do it at home, I I usually for things like this take a water bottle and fill it up with some water. So what you're gonna do is we're gonna do it on both sides. We're gonna start to integrate some movement while maintaining scapular position. So we're gonna first start by setting our scapulas in that same kind of nice stable position. We're gonna put our arm in front of us like this. I want your wrist to be straight up, like you're punching up into the air. This. There you go. And now we're just gonna, while maintaining that scapular movement, bring your arm down, up, and out slightly, and up, and down, and up, and out slightly, and up. So we're going to do some internal and external rotations. But again, I really want the focus to be on that scapula, because that's going to be the first step in stabilizing everything to then strengthen to open up this region to hopefully decrease the feeling you have in your shoulder with the tightness and some of the numbing. So as a recap, it's going to be the massage on your pecs with the tennis ball, the stretch to stretch out the muscles here, just the scapular contractions, holding for 6 and relaxing. The wall slides, again, really focusing on not arching your lower back, maintaining your scapulas in that nice tucked position, up straight for 3 and down for 3. And then just some of the weighted internal and external rotation to try to start to get some shoulder, more lateral extremity movement while maintaining that scapular position. Again, this is just the first step in the program, and then hopefully we can build from there and introduce some more dynamic stuff that's going to involve more of the shoulder muscles and more of the extremity while still maintaining that core stability. Do you have any questions for me?
No, I don't think so.
I can send you a copy of the home exercise program just so you have it in writing because sometimes it's easier to see it and it's more concrete when you have all the reps and the sets. But that is my train of thought is we'll start with this and then eventually develop more once we can get really that core stability because I think that's the first step. Because like I said, the scapulas and that core is this foundation to all the movements from the shoulder, as well as a lot of the musculature here.
Okay.
Does that sound like a plan?
Yeah.
Okay. My last suggestion I have for you is because you do work a lot sitting, is that if every 30 minutes, if you can just um, stand up and go take like a 2-minute walk to go get a cup of water or go get a cup of tea or go do a small task just to break up that positioning of always being like this, it would be a great help. Even if it's just to sit up for 2 minutes and just like you were doing before, just some mobility stuff and just some light stretches just to get you out of that static position. It'll really help because your body doesn't like to stay in one position for long periods of time, and it can help like sitting in one position can exasperate the symptoms you're feeling in the shoulder. Sounds good?
Sounds good.
Any questions for me?
No, I don't think so.
Okay, so then with that, we'll leave it at that for this week. And then next time I see you, we'll see how things are going and we can progress some exercises and maybe add in some extra stuff.
Okay. Thank you.
Thank you so much.
Bye.
Bye.